looks like it's working.
We're live. You're good. You're
Perfect.
good.
Excellent. Well, hello, everybody. Welcome. I am extremely excited to have with us today Dr. Megan Srinivas, who is an infectious disease physician who focuses on addressing disparities in healthcare and health resources. She's an internist. She's from Fort Dodge. You're currently practicing back in Fort Dodge, right?
Yep.
And
Fort Dodge, and I'm technically through University of North Carolina, but I practice at the Community Health Center of Fort Dodge.
awesome. And she went to University of Iowa Medical School, I believe, unless I read something wrong on Google, and has a master's in public health from Harvard University. So she's exactly who we need to be listening to as Americans right now in regards to COVID-19, because she is an infectious disease specialist, and this is an infectious disease. So we couldn't be in better hands in this event today, and hearing what Dr. Srinivas has to tell us. We are very respectful of her time. I cannot imagine how swamped she is right now with what's going on. So we're definitely going to keep this event to no more than 30 minutes. But I just want to get out as much information as we can. I'm Kimberly Graham. For those of you who's for some crazy reason are watching this and have no idea who I am, you probably do if you're watching this. I'm Kimberly Graham. I'm a candidate for United States Senate. I'm running hopefully against Joni Ernst if I make it through the primary here. And you should be getting your ballots, so vote soon. Even if it's not for me, vote, and don't go to the polls. Don't go to the polls on June 2nd. Do not do it. Vote from mail early and safely. So, but all that said, I'm not doing this event about politics. I'm doing this event because it's critically important that we get as much information out to everyone that we can. And we are very fortunate that on this event today, we have English to Spanish interpreter. So people that may be listening who need to hear this in Spanish, there is a way for them to do that as well. Also, Dr. Srinivas has been part of putting together, excuse me, a video to help the Spanish-speaking community in particular that has been hit so hard. Unfortunately, when America gets cold, Black and brown people get pneumonia. That's kind of an old saying, and it just means that health crises and pandemics and so forth tend to affect Black and brown people at a vastly disproportionate rate than others. And so we're really trying to get out as much good information as we can to people. So Dr. Srinivas, just tell us, where are we with COVID-19, especially here in Iowa, and what do we need to know? Small question, right?
Well, thank you for having me, Kimberly. I think it's great to use any medium we can to get the information out there, because unfortunately there's a lot of misinformation and myths circulating. And we really need to head that off to ensure that people are keeping themselves safe, their families safe, their households, their community in general. And alluding to where we are right now, we are still about 2 to 3 weeks away from what we anticipate to be the peak as far as both cases and deaths. And we've already seen, unfortunately, the rise in cases has been exponential over the last few days, few weeks, and we're nowhere near leveling off. We are doing the right things in the sense of trying to enforce social distancing. Unfortunately, it's not as strict as we need to be, but we individually can make it as strict by ensuring that everybody we know stays home. I wish that we could say our local leaders had the authority to enforce those rules. I know a lot of local leaders have been pushing to get that authority, but unfortunately with our Constitution, it all rests in our state leaders' hands as to whether they issue a stay-at-home order. So as much as we can, we need to support our local communities by following the edicts we can. Stay home, only go out for essential runs like grocery store, pharmaceuticals, seeing the doctor if you absolutely need to. And if you do have symptoms and want to see the doctor, make sure that you call us ahead of time so we can create a plan where we can see you safely without exposing others to the infection if you do carry it, or you to the infection in case you're coming in for something else. And we don't want you in that waiting room just being exposed. So there are steps being taken at the local level, at the state level, and we just need to continue to enforce those steps. despite the discussion around reopening, please don't visit farmers markets. That's going to be a number one way to start increasing that spread at an even faster pace and making our peak even higher. And in a state like Iowa, where we have such a rural population, I live in a rural area, we are completely under-resourced. All of rural America is. And so we need to try to flatten that curve as much as possible to ensure that we have the resources we need to meet the demand we'll have.
Yeah. So if you mentioned, only go out if you must, no matter what some of our state leaders may be saying, only go out if you absolutely must, because from my understanding, as we learn more and more about this, there's a reason it's called the novel coronavirus, novel COVID-19. It's new. We've never seen it before. So all of this nonsense that it's just like the flu, or it's just like a cold, or it's a whole new animal. We don't know a lot about it yet. We're trying, I'm sure all of the medical researchers and scientists are pedaling as fast as they can to learn as much about this as they can. But for example, maybe a month ago or a month and a half ago, I think the general thing I heard was, oh, stay home if you feel sick. And somehow staying home if you felt sick was going to help. Now it seems like we know. I just saw on a news clip within the last week that in Iceland, which is a really insular, fairly contained country, they're testing basically everybody. They're testing everybody. And they're finding out there that something like half of people who are infected with this look and feel 100% healthy. You would never, ever know by looking at that person, and that they may never develop any symptoms. So they may be carrying this and potentially, so the fact that you may look and feel healthy does not mean that you're good to go and you should be out shopping and you're okay and you don't need to take any precautions, right?
No, it's exactly true. And that's one of the bits of misinformation that's been out there for a long time that we've been trying to combat, but not effectively since really the beginning of March. So it's the whole concept of being an asymptomatic carrier and a super spreader. So with this virus, from the data we have right now, up to 50% of people, as you alluded to, will actually transmit the virus without ever knowing they had it. In our population, we anticipate that between 50 and 70% will be infected at some point over the next 2 years. 80% of those people will either only ever have mild symptoms, so they'll never realize it was really the coronavirus. They might just think it was allergies or something of that nature, or they'll have no symptoms at all. And it's those people that are really the risk to the population, because they're the ones who think, I'm not ill, I don't need to take all of these precautions, I'm being overly cautious. And because of that, we see them being the cause of anywhere from 3 to 5 to sometimes even 100 other infections. And each of those people who become infected then continue to spread it. And that's how we see exponential spread happening. And that's why for asymptomatic carriers, we call them super spreaders, because they're the ones who really propel this infection out there. And that's where the danger arises, because if that super spreader infects 100 other people, 20 of those people, or 20% of those people, which is 20 people, will end up needing to have hospitalization or some other severe illness measures taken. And those are the 20 people who are going to pay for those interactions. And that's going to continue to spread throughout the community. And that's the reason we have to be so cautious on ensuring everybody stays at home. We don't have sufficient testing to identify who those people are right now. And I don't know when we will. It's a nationwide shortage. And that's something we need to push towards obtaining. But in the meantime, we just need to take broad precautions.
So if somebody, for whatever reason, those of us who are fortunate enough to be able to afford like a grocery delivery or something, I think definitely should do that. But for those who can't, who must go grocery shop or who must go pick up a prescription, what do you recommend that they do in real concrete terms to make sure that they aren't inadvertently spreading COVID-19? I realize there's no way to go zero risk, but to minimize the risk that they will spread that when they are out, say, grocery shopping or whatever.
Yeah, great questions. So a lot of pharmacies have actually been working, I've worked with a few of them myself, to try to develop protocols to try to reduce spread. So some pharmacies are actually offering free delivery now if you call them ahead of time and explain, especially if you're high risk. So just call your local pharmacy. It might not be something that they traditionally offer, but they're adapting. And others are doing curbside service. So if you call them ahead of time, say, hey, I'm going to come at this time for my prescriptions, they'll come out to you with a mask on and gloves and give it to you. And your local pharmacy might be one of the ones doing that. So look into that. A lot of grocery stores, despite charging for delivery, are actually doing pickup service completely free. So I personally do that. I order online and just show up at my designated time. They put it in the car, minimal interaction. I know some people, unfortunately, they don't have a smartphone. They don't have the internet connection to enable them to do that. So the ways you can really minimize risk is a lot of grocery chains in our state have created an at-risk hour. So you can go in the first hour of the morning if you're above the age of 60, or if you have anything that would put you at higher risk of contracting and developing a severe illness. So that includes pregnancy, asthma, diabetes, heart disease, really any other illness that you might have that could put you at a higher risk. Aside from that, I would say anytime you're outside of your house in a place that's a public area, wear a mask. It can just be one of those simple surgical masks. It can be a cloth mask that you wear that you made at home, but anything that can help to stop any droplets coming out of your mouth as you speak, spreading to your surrounding area, significantly helps to reduce the risk. What would be even better than that is a plastic face shield. So if you have anything like a full face shield, that not only protects you because your eyes are protected as well as your nose and mouth from entry of the virus, but it protects you from also, or it prevents you rather, from also having any unintended droplets being spread as you're going around doing the essential services that you need to do. So those are all things that, you know, you don't have to have a professional face shield. You could use goggles that you have at home combined with some kind of a mask, or we can make do with things that we have at home. So I don't want people to think they have to go and put themselves out trying to get these resources. But these are simple things you can do to prevent yourself from spreading this, as well as protect yourself and your household from contracting it.
Yeah. And I just, if somebody does have access to, obviously, if they're seeing us, they probably do have access to the internet if they're seeing this. There are many, many good videos out there on YouTube now of ways to make a mask, a cloth mask, which is not, the idea is to prevent droplets coming from you. It's not to say that that's going to protect you if you're in a situation, but if we all wear masks, the idea is my mask protects you and your mask protects me. That's why when we wear a mask, it's to protect others. It's not so much about protecting ourselves. And there's numerous tutorials. I've looked at some of them myself that are great, that are zero sewing, where you can make, if you don't have a sewing machine, it doesn't matter. You can make a mask from an old t-shirt. You can literally cut one and fold the fabric, and these videos are great. There's so many of them out there now that show you how to make a mask. And my understanding, at least, is you can even beef it up a little bit if you have things like, if you have a non-fiberglass, important non-fiberglass furnace filter that is like a high, I think they call it a MERV rating. It's like the really higher end furnace filters are made of similar, not the same, but similar material to the N95 filtration. And so if you cut a piece of that and fold it inside your mask, that will even provide another layer of protection. But people go into all this stuff on those videos on YouTube. So there's an endless number of videos you can watch to learn how to make your own mask. So there shouldn't be any excuses. If you have the ability to watch YouTube, you should be able to make your own totally inexpensive, no cost mask from scissors and an old t-shirt, if that's all you've got.
Exactly. And I would tell people not to even worry about these additional things like the filtration systems or anything like that, because a lot of what the theory behind N95 is to prevent the person who's wearing it from getting infected, but that's dependent on a tight seal and a proper fit. So anything that we're going to be making at home, even if we're trying to mimic that, it's not going to be able to, because you're not going to get that same kind of fitting and seal. So the big thing, as you said, is really preventing you from spreading it to other people with the masks itself. So you really just want cloth that has very tight threading. You can sometimes even double layer cloth to kind of create that cross effect. Just anything that's going to prevent you from exposing others to your droplets. The face shield, that's where those face shields are going to come in handy. That can also prevent you from getting the droplets into you, because that's going to be a really, essentially, there's nothing that's going to penetrate that face shield as long as you're sterilizing it well. So that's really going to be the top thing you could do to try to prevent transmission, as well as getting it yourself. But in the meantime, the masks are definitely something you should do. And you should also, if you have no resources to be able to make a mask or get one yourself, you can call the public health departments in your counties. A lot of places throughout Iowa have done sewing-a-thons or group sewing to generate these masks for people who don't have access, and are donating them to the county health departments, so that way they can distribute them to people who need them. So your county health department might actually have quite a few that they'd be willing to share.
Fantastic. Yeah, and and we're talking about sort of situation, at least I was in my mind thinking about, well, if you normally can pretty much stay home, but you have to go out, then do this. But of course, now we should talk about the essential workers, like the people that work in our meatpacking plants who are still going to work, postal workers, people that work maybe in a bank or a grocery store. My sister-in-law works at Hy-Vee behind the deli counter. And I will just tell you, for the longest time, now they are, but for the longest time, Hy-Vee was not allowing them to wear masks. And, she was very understandably had a lot of anxiety and was very concerned about that. Nor were they allowed to social distance behind the deli counter. There was no way to do it. And so, I think a lot of people, including me, wrote into Hy-Vee and said, hello, take care of your people. And I think they're doing better now. But yeah, that's a concern. So, for people that must continue to work, they are nurses, they are doctors, they are respiratory therapists, they work at a grocery store, they're a postal carrier. It sounds like the mask and the face shield, if they can fashion one from some kind of goggles or get their hands on one, that they definitely would benefit from those things.
Most definitely, most definitely. The essential workforce, and unfortunately here in Iowa, with not having a stay-at-home order, we haven't defined what that is. So a lot of employers are taking liberties with what they consider to be an essential workforce to try to avoid the costs of accommodating people to work at home. So that's placing a lot of people at risk, and a lot of protocols that haven't been put into place to protect those people who are working. I'm glad to see that places are making progress, and there are places that have been reaching out to various experts and public health departments trying to create those protocols, which is good. Unfortunately, it just, in many places, was not soon enough. And we're seeing that with our meatpacking industry. And it's one of those instances where we see the inequities of our healthcare system and just being exacerbated and being preyed upon, because we're seeing a lot of people who have no other options. Unfortunately, a lot of brown and Black people being impacted disproportionately in this setting.
Yeah, I was told, I've heard this actually from more than one source, that from somebody who was working in a factory here in the Des Moines area, and somebody who was not a meat packing plant, but a different kind of factory, and somebody in a meat packing facility, that they were, at some point, they started taking people's temperatures as they showed up for work in the morning and wouldn't let you in if you had a fever. And as we already just said, that's almost like, why do it? Because that you can be asymptomatic and be spreading this thing all over the place. So the fact that somebody didn't have a fever is kind of irrelevant. It's kind of a moot point if you're just trying to make sure that you're not having this spread. You need to have been doing social distancing and not have people standing so close together, and on and on. We have a question here from Mel Conrad, who's asking, is it true that the state of Iowa is only reporting facilities with COVID cases if it has at least 14 cases? I absolutely don't know the answer to that, Mel, and I don't know if Dr. Srinivas knows either, but do you know?
I'm not familiar with, I wouldn't be able to tell you that. I'm guessing that that's probably internal criteria. I would hope that's not the case, so I'm not sure what's going on.
Yeah, I don't know. So, oops, do we have another question? No. Okay. What else did I want to ask? My understanding is that at least one of these meatpacking plants has actually shut down now. what, if anything, can or should they be doing? I mean, I understand it's asking for your opinion, but your opinion matters because you're an infectious disease specialist and you should be the one, in my opinion, that policy should come from. Like our leaders should be listening to you and people like you and developing policy based on science and based on what we now know about this virus. I know, crazy idea. And so in your opinion, which is a well educated one, what should be happening for us to deal with this now kind of sub crisis? We have this larger crisis. Now we have this kind of sub crisis of the meatpacking plants that are just, all of them are just little mini pandemics in and of themselves.
So shutting down temporarily to ensure that everything is properly sanitized is a very important first step. And it's really required to ensure that we don't have continued passages based on contact surfaces that have already been contaminated. On top of that, guidelines that have been issued by different authorities say that it's okay for people who have tested positive or asymptomatic to return to work, and that should not be the case. That's actually how we continue to have asymptomatic spread. So we really need to ensure that everybody who is testing positive does stay home. Unfortunately, with our tests, and I'm glad to see that when these outbreaks occur, they've started to funnel tests there to ensure that every employee gets tested. But unfortunately, with these tests, we can expect up to a 50% false negative rate just because we don't have a great test yet, unfortunately, for this disease. And with that, we need to be extremely vigilant that we're probably going to negatively test or get a negative result on people who actually are carrying the infection. And so what we need to do is still ensure that people are able to socially distance at work. I know that one of the factories near me put up plastic guards between all employees. That's a great first step, but they're also going to need to take additional steps. Even if they have these plastic guards, people are still going to need to be spaced out sufficiently to try to reduce the spread. On top of that, shifts need to be more sparsely populated than they currently are. And even when you're taking breaks, people need to have breaks scattered and staggered to ensure that there's proper distancing between people as they take those breaks. And then we need protective gear. That's been a huge issue, is that in these factories, people are not getting access to the PPE they need to keep their workers safe. If we can ensure everybody has a mask and gloves, and preferably something to protect their eyes as well, that would be a huge first step towards ensuring that we actually are making sure our workforce is as safe as possible.
And it sounds to me like, I mean, and again, we learn different things all the time. What I'm saying may not even be true a week from now, who knows? But from what we're hearing now, it sounds like there's no vaccine on the immediate horizon, like next month even, or anything like that. And so given that it appears right now, at least as though COVID-19 is going to be with us for quite a while, that these protocols perhaps are going to just need to be the way we do things for the foreseeable future until or unless we get a reliable vaccine.
Yeah, it's going to be a lot of social distancing measures, and hopefully not as strict as we've had to see in places with lockdowns. And we'll hopefully be able to do stepwise measures to enable us to take steps towards being a little bit less strict. But given the studies that came out of just last week from Harvard, we're probably going to need some form of social distancing until 2022 to ensure we get on top of this and try to minimize as many deaths as possible. On top of that, if you look at the trajectory of the infection, it's all dependent on how strict we are in the beginning. So for instance, in a state like Iowa, we are less densely populated. We could get on top of this far more quickly than our counterparts like New York because of that advantage. But we'd have to go into strict lockdown mode right away. If we had done that, we probably, based on the modeling that's out there, could have come out of it within 4 weeks and been on a more lax, slightly reopened kind of timeline. But because we didn't, we're kind of in that state right now where we need to continue to be as strict as possible to try to reduce how long this lasts. And the less strict we are, the longer this will last. And the longer we'll have to be extremely broadly socially distanced. Talking about vaccines, there are 3 that are currently in clinical trials that started back in March. Typically, it takes about 18 months for a vaccine to get through all these clinical trials and finally reach the market. And then on top of that, being mass produced will take another few months. They are expediting. So one of the vaccines is actually already in its 2nd phase, which is amazingly quick for this process. So the hope is, if these work, because we're not even sure if they're effective, but if they do work, at least one of them, we should hopefully have a vaccine that's available at the mass produced level to be broadly administered in about a year from the first time it was entered trials, so next March, which is really great news if that can happen. But it also means that we need to take these other public health interventions in the meantime for sure.
Yep. There's a question from Facebook that says, does Dr. Srinivas believe we should be reopening the economy with rising numbers of confirmed cases and deaths?
No, definitely not. No, not at all. The way that we need to approach reopening the economy is it's a tough conversation because people are suffering from the deaths, but they're also and the infection, but people are also suffering from not having access to their income. Especially, I mean, a lot of people in our state live check to check and are in dire need of every penny that they were working for. So it is a careful balance. The bailout to try to get checks out to people is a good thought process. It's just not enough, and it's not happening quickly enough to fulfill that need. So I'm hoping that we could definitely see more leadership taking proactive steps and understanding that we need to fill those niches to help our population. But we do also need to keep people safe, because when you find out that the breadwinner of the family falls ill and dies, and then that family no longer has a paycheck at all possible, that's a whole nother issue as well. And every life matters so much. So we need to take that into consideration when we're having these discussions. That being said, every public health model and every public health principle really dictates that you can't reopen an area where a pandemic is happening prior to a peak. If you do so, you're just going to exacerbate that peak. It really isn't even immediately after the peak that it's safe to open. It has to be once you start to see the level of infection go to such a low point that you're not worried that reopening is going to drastically cause a second peak. And the principle that we use to dictate that is called the R naught, which means how many other people an infected person infects. When we see an R naught of less than 1, meaning that each infection is causing less than one other person to be infected, that's a point when we can start having discussions about reopening the economy. Because that's a point where we can say, hey, we understand what's happening. We can mitigate the infection and contain it, even if we start to see an additional rise. But in order to be able to really have an understanding of that, we need to ramp up testing to be able to gather the data we need to generate the true R naught, to generate the true penetration of the infection into our population.
Yeah, absolutely. And, and regarding the recent stimulus bill, there's going to have to be at least one more, maybe several more, from a just a practical, logistical, financial perspective. The idea, I find the idea of $1,200 for as a one-time payment for people that won't even last them a month. I find that insulting and appalling and an insult to hardworking Americans. Other nations like Canada are doing in the neighborhood of $2,000 a month for 3 months for every adult, which is at least sufficient to kind of survival, get you by. And other Western European nations are doing similarly. In other words, other wealthy, prosperous, capitalist nations are doing far better at giving their citizenry money to get by and to be able to stay at home and not put themselves at risk. And my opinion is we are failing, big F, for the United States in how we're dealing with this, as far as how we are making sure that our average everyday worker is able to survive this. And well,
when you look at even the small business bailout, it was intended to help our small businesses, which Iowa thrives on and makes us who we are, to survive this. And unfortunately, only 25% of that money actually went to small businesses, while the 75% went to large corporations, many of whom are still making a profit in the midst of this. And so
right.
we need to pay attention on trying to give the resources to those who need it.
Right. I mean, I have no problem if it's necessary well, I shouldn't say I have no problem. I have some problem, but I don't have too big a problem with bailing out a big corporation if they truly need it. And that's a corporation that for some reason we've got to keep going. Fine. I would talk about that. But the fact that we've been bailing out corporations that are highly profitable, are in no financial trouble whatsoever, over bailing out small mom and pop businesses on the town square in Fort Dodge or Sheraton or Indianola or anywhere else. And these people go and try to get any help. And a lot of times they don't even qualify for a variety of reasons. Or the money was all gone by the time they even got to get their application through to process. So we got to do a lot better on that. And our last question, and then we'll wrap it up. Oh, I want to talk about the Spanish video before we go. And then also we have a question. What are your thoughts on the upcoming election, vote by mail, and what the state should be doing to protect people?
So I think that our Secretary of State has actually done a really great job of trying to issue a vote by mail initiative, which is far above what many other states are trying to do. So I think that's great. Kudos to him and kudos to all the people who've worked to advocate for that and all the county auditors who are working to make that a possibility. That is going to be one of the biggest ways we keep our people safe. And so I think definitely vote by mail. Even early voting is still not that safe. So just, go online, sign up, get your ballot in the mail, submit it. It's all paid for. It's a pre-stamped envelope, and it gets business to our postal service that has been working so hard for us too. So I highly advocate that you do that, regardless of who you vote for.
Yeah, and so if you've moved or you're a new voter, you won't get a absentee ballot request form in the mail. But if you're a regular voter and you've lived where you are living since the past election, you're supposed to get an absentee ballot request form in the mail. You fill that out, make sure you fill out all the highlighted spots because sometimes people miss a spot and then we run off the rails. Fill out all the spots where it's highlighted, it's pre-stamped, mail it in, then they'll send you the ballot itself, fill that out and mail that back. And both of those are already pre-stamped, so you don't even need to find a stamp. And the last thing, and maybe most important thing that we want to talk about is that you have collaborated with people to produce a Spanish language video. And I know we've already been pushing it out on our Twitter and our Facebook today already. So people, if you don't know what I'm talking about, go to our Facebook or our Twitter at Kimberly for Iowa, and you can see it there. But tell people a little bit about that before we sign out.
Yeah, so as we were talking about, there's a lot of unfortunate inequities in who's being infected with COVID-19 and the fatalities surrounding it. So we're trying to create different videos, animation videos. They're just short little clips that help to spread the information in different languages, as well as in a way that is oriented to where you live. Because some of the groups we're seeing being infected at a higher rate and having higher fatalities are Latinx, Black community, Indigenous community members, and even just rural areas. And there are a lot of all of those populations within Iowa. So we're trying to do various series. Our first Latinx video came out today. Thank you all for sharing it. And we're just trying to get it into as many hands as can benefit as possible. So please take a look. It's less than 2 minutes and helps to hopefully relay some information that can help keep you and our community safe.
Fantastic. Well, I don't see any more questions, so we'll wrap it up to be respectful of the doctor's time. And thank you, Dr. Srinivas, for everything you're doing to help keep us safe and to get out solid, scientific, evidence-based information out there so that we all know how to stay safe and keep our families and our communities safe. Yeah, so thank you very much. And thank you to everybody who's here and everybody watching later on video. And any final words?
It's tough, you all. I know it. I know it's an anxiety creating situation. It's extremely stressful for each and every one of us for various reasons, whether you have kids at home or whether it's because you can't see your parents and they need your help. But by sticking in it together and taking the right steps now, we can stop this sooner than later and get life back to normal. We're all in this together. Just because we're socially distancing doesn't mean we have to be emotionally distancing. So reach out to the people you care about, let them know you're there for them, and that they can then reciprocate and be there for you. Because despite being in this situation, it's more important than ever that we connect. So stay safe, stay healthy, stay home. We can do this, Iowa.
Yeah. Thank you so much, Doctor. Take care.
Thank you,
Bye,
Kim.
everybody. Bye-bye. Yeah. Oh, okay, great. Yep. Samantha, can we put the